should all letters come from people in the fellowship you are going into? I think you can probably answer this for yourself. Yeah, you should have at least 2 from the specialty you're going into. But you really want letters from the people that know you the best. So you need letters from the specialty to say they'd be really good in the specialty. But if there's some, let's say you want to go into nephrology, but someone from general pediatrics worked really close with you, thinks you're outstanding, said like 10 times to you, when it comes time, I'll write you a letter of recommendation. You want that letter because they are totally dedicated to make sure you succeed. They will write an amazing letter. So as long as you have other people saying, yeah, you're going to do great in the specialty, you're the right fit, and you have someone else saying, this is an amazing human being, those 2 concepts together really help sell you. So you want to make sure that the people who are writing the letters know you well and really care about you. Now, you may not know who cares about you. Most of the attendings here care about you. If you've worked enough time with them, if they've relaxed and had normal human being conversations with you, the majority of them will write letters for you, okay? But again, don't go asking everybody. You don't need 15,000 letters of recommendation. You may want to ask for about 5 and get 4. For medical students going into residency, I tell them to ask for 6 because people could die or move on or they can't get in touch with them. You're in a different area. If you ask for 5, you're definitely probably getting 5. So you may not even need to ask for 5. With writing letters of recommendation, just remember we're all procrastinators. Remind people that they need to get it done, especially if you ever ask me for a letter of recommendation. I'm going to need 1,000 reminders. Are we talking about a physical letter? Well, yeah, like if you can give someone a real physical thank you letter, I'm telling you, it makes a huge difference. An email's an email. Yeah, you took the effort and you thought about it. If you're really genuine and really sincere and really have some really nice things to say in the email, yeah, it makes a difference. But a real, genuine, handwritten thank you letter, they don't happen anymore. And you don't need to say a lot in it. The fact that you took the time and then put it in an envelope and sealed that envelope and walked it somewhere to finally get to you, that's huge. Anyway, so yeah, I'm kind of talking about a physical letter. Does having a letter from an away elective where you are really interested in matching at helpful? Yes. So like I said, when you're applying to fellowships, you can have 5, 10, 15, 20 letters all sent into ERAS and in your bank of letters. You can only send 4. So if you're going to apply to CHOP and Pittsburgh and Boston and all these different places, and you did an away rotation at Pittsburgh and an away rotation at Philadelphia, if you think that they wrote you good letters, yes, you would then make sure that the Philadelphia letter goes to Philadelphia plus 3 from downstate that are, people who really know you. Or the one, if the one from Pittsburgh you sent to Pittsburgh, and then the 3 from downstate. If you send 2 from outside places, that's a little weird. Now, if you're back to the question about cardiology, if you're applying to cardiology and you did a CICU rotation at Columbia and, Dr. Aponte Patel really thought you were amazing, get a letter from her for cardiology and from our cardiologist and 2 from people who know you really well from downstate, Kings County, Sloan, whatever. That way, you have a second cardiology letter, and that would be okay. Is it helpful to have a letter from your research mentor if you haven't worked with them in a clinical setting? Absolutely. Going into fellowship, research is actually quite important. If you haven't done it, don't freak out. If you have done it, you want to flaunt it. So having one from your research mentor is important. You want to sit down with them and talk about, what they think is important in far as the research when you're going to sell yourself for the fellowship or for the job that you're going for, because that will then help them construct what they're going to write, helps you say what you're going to say, and the 2 of those things will then go together nicely and tell a full story. And they may also, I would expect, kind of know how you do clinically.